So how in the world did the United States, the one country that was ranked #1 for pandemic preparedness, end up with one of the worst death tolls on the entire planet? Well, that's the central mystery Michael Lewis dives into in his book, The Premonition. And the answer, it turns out, reveals a flaw that's baked deep, deep into the American system.
Okay, let's just start with this paradox, because it's a big one. In 2019, a panel of top public health experts looked at every country on Earth and decided the United States was the most prepared nation for a pandemic. Not in the top 10, #1. And yet, when the test actually came, the performance was, well, it was catastrophic. The gap between that reputation and the reality couldn't have been any wider.
And this gap wasn't just some abstract failure. It had a real, devastating human cost. A study in the medical journal The Lancet came up with this term, missing Americans. It's a staggering number. 180,000 people who would still be alive today if the US death rate had simply matched the average of the other 6 G7 nations. It's just a profound failure, represented by that number.
So what on earth went wrong? Look, this wasn't about finding a single person to blame. This was about deep, systemic flaws in the machine itself. These were cracks in the system that actually prevented America's best and brightest from stopping the very disaster they all saw coming.
To find that first crack, we have to go back to a place you would never, ever expect. Because the foundation of America's pandemic strategy, the playbook for social distancing, it didn't come from the CDC or some top-secret government lab. Believe it or not, it started at a high school science fair.
So the story kicks off with a teenager from New Mexico named Laura Glass. For her science fair project, she asked a really simple question. What would we do if we didn't have the right vaccine in time? Her dad, a scientist, helped her build a computer model, and what they found was revolutionary. Simple things, like closing schools and keeping people apart, were incredibly effective. This science fair idea eventually gets discovered by this small, forward-thinking team in the Bush White House and becomes the core of the U.S. pandemic plan. It's just a brilliant example of how the best ideas can come from way outside the official channels.
But, a plan is totally useless if no one is willing to actually execute it. And this brings us to our first hero, Dr. Charity Dean. She was a local public health officer in California, a true disease hunter on the front lines, who spent her whole career making these tough, proactive calls that the system just wasn't built to handle. This was her thing. She had this scribbled on a Post-it note in her office. Courage is a muscle memory. It perfectly captures her whole philosophy. You build the strength to act by acting, over and over again, especially when it's hard. And her career was basically one long workout.
Time and time again, she just clashed with the bureaucracy. During a meningitis outbreak, the CDC wanted to just observe it, like a science experiment. Charity's response? Are you kidding me? A kid just lost his feet. She forced them to take aggressive action. Later, she single-handedly shut down a private clinic because she suspected a hepatitis C outbreak. The CDC was aghast. They told her no local health officer had ever done that. But guess what? She was right. So in early 2020, when she felt that foreboding, that feeling of a tsunami coming, she knew what action looked like, but the system all around her just didn't.
And her whole story reveals this core, kind of messed up part of public health bureaucracy. See, there are two types of sins. A sin of commission, that means taking action, is risky. If you're wrong, you get fired. But a sin of omission, failing to act, is totally safe. Nobody blames you for the disaster that didn't get prevented. And in a pandemic, this incentive structure is perfectly designed to cause a catastrophe. It rewards waiting, when speed is literally the only thing that matters.
Okay, so while Charity Dean is fighting this battle from inside the state government, there's another group fighting it from the shadows of the federal government. They were a small band of doctors and experts who realized the official response was failing and decided, you know what, we're going to form our own.
And get this, these weren't just any doctors. Carter Mecher and Richard Hatchett were two of the key guys who had taken that science fair project and turned it into the official U.S. pandemic plan years earlier. In January 2020, when they sensed disaster, they reconnected on an email chain they codenamed Red Dawn, after that 80s movie about a high school resistance group, and they called themselves the Wolverines. Their mission was to share intelligence and push for the plan that they wrote, because it seemed like nobody in charge was even reading it.
The Wolverines had a code for what was happening. We're in Man Gulch. Now, this refers to a tragic wildfire back in 1949, where a team of smoke jumpers parachuted in, thinking they were fighting a small blaze. But the fire was growing exponentially, totally unseen in the tall grass. And then it suddenly exploded, racing towards them and trapping them. For the Wolverines, COVID-19 wasn't some distant problem. It was an invisible fire that was about to overrun everything. And this is where you really see the terrifying disconnect. In early February, the Wolverines were privately warning that transmission is now smoldering out of view, just waiting to explode. Meanwhile, the CDC's official public message was that the risk to Americans was low. So you have one group screaming about the fire in Man Gulch, and the other group is basically telling everyone it's a lovely day for a picnic.
Eventually, the Wolverines connected with Charity Dean, and in one stunning phone call, she finally asked the question that had been haunting her. And James Lawler, one of the Wolverines, gave her the answer. And it was just chilling. Nobody was in charge. The official system was paralyzed. The only people trying to steer the ship were this small, informal group of mavericks operating through a secret email chain.
So this really brings us to the core of the whole thing. This wasn't a failure of people. The country had brilliant, dedicated experts like Charity Dean and the Wolverines. It was a failure of the system. It was like having a team full of all-star players, but with no coach, no game plan, and no one leading them onto the field.
You can really boil it down to this fundamental conflict between two opposing forces. On one hand, you had the mavericks, the bottom-up, proactive thinkers trying to get ahead of the fire. And on the other, you had the machine, the top-down, reactive bureaucracy, totally paralyzed by the fear of making a mistake, of committing that sin of commission. In a crisis that moves exponentially, a reactive approach is a guaranteed loss.
So let's just break down these flaws, right? First, the leadership vacuum. Nobody was in charge. Second, stifled initiative. The system was literally designed to sideline, ignore, or even punish people like Charity Dean who tried to act decisively. And third, information silos. Data was trapped at the local, state, and federal levels, so no one could piece together the full picture and see that fire for what it really was. And this all leads us back to the book's central point. America had the talent, the expertise, the resources. The players were not the problem. The problem was the system that left them sitting on the bench. Because in the end, all the preparation in the world is meaningless. You are what your record says you are.
The story of the Wolverines and Charity Dean is incredible. It's one of foresight and real courage. But it's also a huge warning. The pandemic exposed these deep, structural flaws in America's ability to handle a crisis. And it leaves us all with one really critical question to think about. Now that we've seen the fire, have we actually done anything to make sure we're ready for the next one?